start sharing my screen. Okay, here we go. Okay, can everybody see where it says AHIP Study Hall?
Yes.
Okay, perfect. All right, guys, this is Module 1, 2023. The learning objectives are the same as last year for those who took it. And there's some background noise, so if everybody will please just mute and unmute as you have questions, that'd be great. Learning objectives, the different ways to get Medicare benefits, eligibility and coverage under A and B, original Medicare premiums, help for beneficiaries with limited income, and original Medicare Part D. Charlie, are you able to let people in?
Yes, I'm taking care of it.
Okay, thank you. So the basics. Medicare is a federal health insurance program for those who are 65 and older, those younger who are disabled. Medicare eligibility does not consider income for eligibility. Premiums can be higher based on income or lower for low income who are eligible for additional assistance. Does everybody know what that additional assistance is called? Extra help. Individuals or Medicaid. Individuals can receive their Medicare medical coverage directly from the government, original Medicare, fee-for-service Medicare, or through a private health plan. Part D is only available through private health plans. So a little background on Medicare. Medicare began as a fee-for-service program. Beneficiaries could receive healthcare benefits from any Medicare provider paid directly by the federal government. Medicare evolved, giving the beneficiary an option to receive benefits and care through managed care plans. And in 2006, Medicare began providing coverage for prescription only through private health plans. As most of us know, Part A of Medicare is hospital. It covers inpatient care, including skilled nursing, rehab, and hospice. That is something that everybody should pay attention to. Part A covers hospice. That is something you would want to put down in your notes. Part B medical covers a range of outpatient services such as physician care, some drugs administered by healthcare professionals such as vaccines and IV medications. That is something else that I would write down in my notes. Part B medical covers a range of outpatient services such as physician care, some drugs who are administered by healthcare professionals that in particular might show up again, such as vaccines and IV medications. Part C is Medicare Advantage. It covers Part A except for hospice, paid for by original Medicare, and Part B benefits. Part D prescription drugs, such as those picked up from a pharmacy. That is important to know as well, that Part D drugs are the drugs that are picked up from a pharmacy and not administered by a healthcare professional. Part E, lesser known, Medicare law regulates miscellaneous programs. Medicare cost plans only offered in a few states, mostly found in rural areas. Medicare SUPs, such as Medigap, PACE, the program for elderly all-inclusive care. Part E is also something that I would put down in my notes. And again, Part E is a lesser-known Medicare law that regulates miscellaneous programs. Medicare cost plans, Medicare SUPs, and PACE. Different ways to get Medicare. Original Medicare is A and B and can be combined with a MedSup or a PDP. MA plans are Part C with or without Part D benefits. PDPs are prescription drug plans. Medicare cost plans. You're going to see this in Module 2 more than in Module 1 when you take the test. So kind of want to start paying attention to cost plans. Medicare cost plans are only offered in a limited number of states, most frequently found in rural areas. PACE is a program for all-inclusive care for the elderly and Medicare Medicaid plans. Original Medicare eligibility, entitlement, and premiums. Part A, inpatient hospital, skilled nursing, hospice, home health. Part B, outpatient professional services, such as those provided by a doctor or non-physician professional, such as a nurse practitioner. Lab services, DME, preventative, and other outpatient medical services. Those living in Puerto Rico are not automatically enrolled and must sign up. That last sentence is important to know. Those living in Puerto Rico are not automatically enrolled. Again, I'm going to ask that everybody mute unless you have a question, and then please unmute yourself to ask the question and interrupt me at any time. Eligibility, age 65 or older, or those younger with certain disabilities. All who get Social Security income or certain disability benefits from Railroad Board for 24 months, and those with ALS or ESRD. You must be a U.S. citizen or lawfully admitted with permanent residence and has been residing with the U.S. within 5 years or for 5 years before the month of which they apply for Medicare. That is an important to know for the test. That as long they do not have to be, well, they are a U.S. citizen or lawfully admitted for 5 years before the month of which they apply for Medicare. Others will have to sign up for A and B if they wish to be enrolled. Those close to 65 are not getting benefits from Social Security or the Railroad Retirement Board may sign up during initial enrollment period, 3 months before their 65th birthday and ends 3 months after. Those with ESRD can sign up at any time. Medicare coverage begins the 4th month of dialysis, earlier if certain conditions are met. That is important to know, that the patients with ESRD can sign up at any time. Medicare coverage will begin on the 4th month of dialysis. Those with ALS, also known as Lou Gehrig's disease, automatically receive Part A and B benefits the month Social Security disability benefits begin. So ESRD is the 4th month of dialysis. ALS, also known as Lou Gehrig's disease, is immediately as soon as they sign up. Individuals who do not enroll in Part B, A, if they have to buy it, when first eligible, can enroll during general enrollment period, which is January 1st through March 31st. Prior to January 1st, 24 coverage will begin on 7/1. On or after January 1st, 2024, coverage begins the first day of the month following the enrollment. Those with group coverage through their employer or spouse's employment may enroll in Part A or B anytime while covered during a special enrollment period that occurs during the 8th month period immediately following the last month of group coverage. It is important to know that it is a 8-month period when you lose group coverage. Beginning January 1st, 2023, the Secretary of HHS, I repeated myself, may establish a SCP for those entitled to Part A and R65 meet residency requirements and meet conditions that will be specified. New SCPs for enrollment in A and B if individual is not eligible for premium-free Part A apply to those impacted by an emergency or disaster, allows eligible beneficiaries or their authorized representative to enroll up to 6 months after the end of declared emergency. If this caused the beneficiary to miss out on an enrollment opportunity, that was new this year, at least highlighted in the AHIP module. Beneficiaries impacted by a health plan or employer error may enroll into Medicare Premium Part A up to 6 months after notifying Social Security of the error. These 2 bullet points, the second and third bullet points, are new to the AHIP study module this year. So I would definitely take a picture with your phone or write that down. Formerly incarcerated beneficiaries allows for enrollment following their release up to 12 months post-release. They may choose to retroact coverage back to their release date by paying back premiums not to exceed 6 months, or coverage to begin the month after enrollment. So they have 12 months to get enrolled into whatever they're going to get enrolled in, get signed up for Part B, do Med Sup, do a MAPD, and they can pay those back premiums for Part B for 6 months. Or they can just sign up and have the coverage begin the following month, which is pretty typical. Exceptional circumstances allows CMS to grant a 6-month SEP on a case-by-case basis for beneficiaries who missed IEP, GEP, or other SEPs. That was also new on this AHIP study materials for this year. So if everybody wants to take a screenshot real quick of this, I'll leave it up for just a second. Okay. ESRD. This one in the test got me. I missed this question, so I wanted to make sure that we touch on it. Beneficiaries eligible due to ESRD lose eligibility 36 months after kidney transplant unless eligible for another basis. So I was not aware of that rule. I don't know if it's new or if it is an existing rule, but it did not register to me when I was taking the test. So I wanted to make sure that we went over that beneficiaries eligible due to ESRD lose eligibility 36 months after kidney transplant unless eligible under another basis. However, 2023 such beneficiaries may stay enrolled in Part B only to cover immunosuppressive drugs if they have no other health coverage. So if they lose it due to the fact that they got the transplant, probably under 65 in this scenario, they can keep Part B to help pay for those drugs as long as they do not have other coverage through an employer. Medicare coverage for those with ESRD typically begin on the 4th month after dialysis begins. I repeated myself on that because I feel like now that Medicare Advantage plans over the past couple of years have covered end-stage renal disease, that maybe there's some nuances or things that we still need to learn. Part A entitlement and Part B enrollment. Individuals are entitled to Part A if they are eligible for premium-free. Part A can also sign up anytime after they turn 65. Their benefits start 6 months back, but not before their 65th birthday. If they have not signed up by the time they apply for Social Security, they will automatically be enrolled. Coverage will retro back for up to 6 months. Individuals are enrolled in Part B and remain enrolled as long as premium is paid or paid for on their behalf. Getting tongue-tied today. Other ways to get Medicare eligibility overview. Part C must have A and B and reside within a service area. That is on the test. Part D, entitled to Part A and or enrolled in Part B and reside within the service area. That is on Module 2 test. Cost plans, entitled to Part A and or enrolled in Part B. If they do not have Part A coverage, they will not have those benefits under the cost plan and reside within the service area. So that is going to be on the test. It's going to be a wonky question. And as I mentioned before, after we get through this slide deck, I will post some questions for you all so you can kind of think the way they're asking them. Medicare and Medicaid plans must be eligible for both Medicare and Medicaid, meet state-specific eligibility requirements, and reside within the plan service area. PACE plans. I know a lot of people do not sell PACE, but they do ask a lot of questions on the module test. PACE plans, 55 and older, certified as eligible for nursing home care by their state, ability to live safely in a community setting at time of enrollment, reside in the service area, and meet any additional program-specific eligibility conditions under the PACE program agreement. So they have to be eligible for the nursing home and safely live within a nursing home community. So in a community setting, it's going to be more geared towards the nursing home. Most are eligible for premium-free Part A. Individuals 65 or older are premium-free. They are They or their spouse must have worked and paid Medicare taxes for 10 years, or all eligible individuals due to a disability, ESRD or ALS. Those who have to pay Part A premium for 2023, it is 506. Those who or their spouse paid Medicare taxes less than 30 quarters, 278 if they paid 30 to 39 quarters. So 506 for less than 30 quarters, 278, 30 to 39 quarters. Those who do not enroll in Part A when first eligible may pay a penalty up to 10% unless they have a SEP. Here's the new premium based on income. So in 2023, the standard premium is $164.90. Most pay a standard premium. Some pay more based on income as reported 2 years prior. So as you can see the chart below, it is $164.90 if they make $91,000 or less for an individual, or $182 joint. This is on the test. The question is asked, so-and-so makes a comfortable living of $100,000 a year. How much will they have to pay in premium, or will they be charged for premium? So it is important to know that if they, the premium does increase if they make $100,000, even as an individual, because it's $91,000 to $114, $182 to $228 for joint, and that premium will be $230.80 this next year. That is on the test. Not the premium amount, but if they make over $100,000. Part B, payments and penalties. Part B premiums may be deducted through Social Security checks, Railroad Retirement Board checks, or Office of Personnel Management checks. They can also receive a bill every 3 months from Medicare. Employers may pay monthly Part B premiums on behalf of the retiree. Those who do not enroll in Part B when first eligible, premium increases 10% for each full 12-month period that they could have had enrolled but did not. This is known as late enrollment penalty. It's referred to through here as LEP. LEP exceptions, those who have group coverage through current employer or spouse's employment, that is on the test, are not subject to penalty if they enroll in Part B while covered or during their 8-month special enrollment period after leaving group coverage. That paragraph is chopped into 2 questions on the exam. So I'm going to repeat it one last time. LEP exception. Those who have group coverage through current employer or spouse's employment are not subject to penalty if they enroll in Part B while covered or during their 8-month special enrollment period after leaving group coverage. An LEP is late enrollment penalty. Help with LIS. LIS is a low-income subsidy. Beneficiaries can have help to pay for Medicare Part A, if any, and Part B premium, A and B deductibles, and cost shares, and or Part D prescription drug costs. That is on your Module 2 test, or Module 3. It's running together at this point. Beneficiaries may qualify for the following by applying through their state Medicaid office. So, pay attention to this question. They can apply through their state Medicaid office for Medicare Savings Program. Qualified Medicare Beneficiary Program is one type of Medicare Savings Program. Those who qualify and are on a MAPD also get help with their cost shares. Do not confuse that with MSA, which is a different type of program. It's a plan that you can have. But Medicare Savings Program is through the Medicaid office. Medicare Savings Account is a whole nother plan that is not through Medicaid. Just keep that in mind. Part D low income subsidy, aka extra help, helps pay for prescription coverage, RX coverage. Those interested in Part D help only may call Social Security Administration or apply online. Extra help is not available in Puerto Rico, U.S. Virgin Islands, Guam, or the Northern, and I don't know how to say that, or American Samoa. Those who do not qualify for extra help may qualify for help through the state's Pharmaceutical Assistance Program. Medicaid is to help with healthcare costs not covered by Medicare, such as custodial long-term care. Beneficiaries with limited income and resources are encouraged to apply for their state Medicaid office to determine eligibility for various federal and state programs. If a beneficiary is enrolled into Medicaid during the public health emergency and coverage has recently been terminated, will be eligible for a SCP for up to 6 months and can choose retroactive coverage back to the date of termination from Medicaid or coverage to begin the month following enrollment. This is extremely important, this AEP, because as we know, many people who qualified due to the public health emergency, also known as COVID, are losing their Medicaid coverage. These individuals are going to have to be identified and moved into a plan that suits their needs. They will have a SEP for up to 6 months. They can retroactive backdate the termination for new coverage. So keep that in mind. Remember that because they do have a 6-month SEP. I know here in Oklahoma, we have 300,000 Medicare, Medicaid beneficiaries who are losing coverage this year. Part A benefits and original Medicare cost sharing. Inpatient hospital care, including care provided by acute care hospitals, critical access hospitals, inpatient rehab, and long-term care hospitals, have up to 100 days of home health care after leaving the hospital or skilled nursing facility. Blood, skilled nursing facility, and rehab after 3-day hospital stay. Medicare Advantage waives 3-day hospital stay requirement. Inpatient psychiatric care up to 190 lifetime days. Please pay attention to that because that is going to visit you again. 190 lifetime days and hospice. In 2023, beneficiaries pay the following under Original Medicare. $1,600 deductible for each benefit period starts the day they are admitted to the hospital or skilled nursing facility and ends after the beneficiary has not received care for 60 days in a row. That is a $1,600 deductible under Original Medicare. Days 1 through 60 have a $0 coinsurance for each benefit period. Days 61 through 90 are $400 per day each benefit period, and days 91 and beyond, $800 coinsurance per each lifetime reserve day after day 90 for each benefit period. Clear as mud? Lifetime reserve days a beneficiary can use after being inpatient for 90 days. They have a total of 60 reserve days per lifetime. Beyond reserve lifetime days, they will incur all costs. In 2023, beneficiaries pay the following under Original Medicare. Days 1 through 20, 0. Days 21 through 100, 200. And they incur all costs after day 101. Medicare Part B generally covers physician and other healthcare professional services, outpatient hospital services, clinical lab and diagnostics such as x-rays, MRIs, and CT scans, medical equipment, home health, physical therapy, bariatric surgery, and chemotherapy outpatient goes under Part B. Ambulance, chiropractic, opioid use disorder treatment, e-visits, televisits, diabetic supplies, vaccines, dialysis, outpatient mental health, certain telehealth services, transplant, physician services, and drugs. In 2023, beneficiaries pay the following amounts for Part B services under Original Medicare. They will have a $226 annual deductible. Does not apply to certain preventative services because those come in at what? Zero. After deductible, 20% of Medicare approved costs for Part B covered services. Beneficiaries covered under Original Medicare and MA plans will have no cost sharing for most preventative services. Not covered by A and B are those extra benefits that we like to hear about. Routine dental and dentures. Cosmetic surgery, as we know, is not covered under most plans. Custodial long-term care, healthcare outside the U.S., concierge care, outpatient prescription drugs, massage therapy, routine eye care and glasses, and hearing aids. Original Medicare Part D beneficiaries in Original Medicare can get a standalone PDP, generally except for dual eligible must select a Part D plan. Beneficiaries who enroll in a Part D plan typically pay a premium annual deductible and per prescription cost share. When choosing a plan, beneficiaries should consider premiums and cost sharing, formulary, and network pharmacies. There are not a lot of questions on appeals. There is one question that's coming up to mind, and again, I'll look at my notes at the end of this to go over some of the questions. Of course, we need to know this information. It always comes back about Module 3. So we'll go over this, but this is not something that you absolutely need to remember for Module 1 test. If there is something through this, I will make note of it for you. Those receiving Part A or Part B services through Original Medicare have the right to appeal Medicare coverage and payments. Beneficiaries should look at their MSN, Medicare Summary Notice. MSN shows the Part A and B services and supplies providers and suppliers billed to Medicare on their behalf. I'm going really fast, guys, because there's not a lot on the questions, but I want to make you aware of what it says in the module. MSN also shows what Medicare paid and what the beneficiary owes. The MSN also shows what may be fully or partially denied. Claims can be tracked down electronically on mymedicare.gov. That's just good to know. As agents, beneficiaries must file a Part A and B appeal within 120 days of date they get the MSN in mail. Appeals are sent to Medicare administrative contractor that process their claim. Instructions are found on medicare.gov. If beneficiary does not agree with the MAC's decision, they have 180 days after receiving decision notice to request reconsideration by a qualified independent contractor, QIC. There are additional levels of appeal depending on the level of controversy. Whew. And we'll get into that in future modules. Fast appeals for certain services. Beneficiaries on A and B can use a Medicare fast appeal if they feel services are ending too soon, and that is not on the test. This includes services provided by hospitals, skilled nursing facilities, home health, rehab, or hospice. Their provider will give them written notice before ending services. This includes how to file an appeal. Beneficiaries can file grievance about their providers or quality of care. Instructions are on medicare.gov. That is on the test. That is the one question through all of when we're talking about grievances or appeals that will be on the test. So if a beneficiary feels like they cannot get into their doctor in a timely fashion, they may file a grievance. There is a 24-hour helpline. 1-800-MEDICARE can be used for asking about a claim, coverage, and benefits, premium payments, or other questions about Medicare. Medigap supplement insurance works only with Original Medicare sold by private insurance company to fill in the gaps. You need to know that to answer another question, but not specific to that. This is good knowledge on what they're asking about an Advantage plan, to know that that would not pertain to an Advantage plan, but refers more to a supplement. So works only with Original Medicare sold by private insurance companies to fill in the gaps is a Medicare supplement and not Medicare Advantage. Coordinates with original Medicare. Some Medigap policies cover limited benefits not covered by Part A and B, such as extra days inpatient and foreign travel. Medigap is not original Medicare or Part C. Cannot be combined with a Medicare Advantage plan and is illegal to sell to someone who is already on a MA health plan. All of this is important to know, but they're going to ask you in a very different way. That's where they like to get confusing in the questions, which is what we're going to go over after I get through with these slides. Medigap is available in standardized benefit plans, A through N, different plans available in Massachusetts, Minnesota, and Wisconsin. Turning 65 and signing up for Part B triggers a 6-month Medigap open enrollment. Medigap insurers must issue a policy regardless of pre-existing conditions. This is called guaranteed issue right. This is something I preach about in our trainings. A lot of us sell Medicare Advantage, but sometimes we need to really look at, are we giving our turning 65 service that they may need, which is that guaranteed issue into a supplement or Medigap plan. Leaving a MAPD may trigger a guaranteed issue right. Please look up state-specific Medigap laws. All Medigap plans pay for some or all of the following. Part A, coinsurance, 365 additional days hospitalization. Part B, coinsurance, the first 3 pints of blood, and hospice coinsurance or copayment. Medigap without drug coverage. Medigap H, I, and J offer non-Medicare drug coverage, no longer to be sold after January 1st, 2006, but some beneficiaries are grandfathered in. Those enrolled in Medigap must also enroll in a PDP. That's the only thing you need to know, that if somebody signs up for a supplement, a Medigap plan, they need a standalone PDP. Credible coverage. Non-Medicare insurers, including Medigap, are required to notify beneficiaries annually as to if they are credible or not. Credible coverage is equal to or better than Medicare standard. That's the one sentence you need to know. Those who do not maintain credible coverage must pay a late enrollment penalty if they enroll into a Part D unless they qualify for extra help. That sentence doesn't make sense. Those who lose credible coverage will have a SEP and no late enrollment penalty. Changes to Medigap after 12/31/2019. This was in the study materials. Newly eligible may not purchase a Medigap that pays for Part B deductible. Those already enrolled may remain. Those who became eligible before 2020 may enroll in plans that cover Part B deductible. Newly eligible, age 65 on or after January 1st, 2020, became eligible due to age, disability, or end-stage renal disease on or after January 1, 2020. This is not in the test. Oh, I guess that was it. Okay, back to you all. Okay, so I cheated for you all. And now we are going to go into some of these questions. Okay, I have a question if everybody wants to unmute. Here we go. If someone continued working with his company and was insured under his employer's group plan until he reached 68, will he get a late enrollment penalty?
No.
Very good. Here's another question for you all. Oh, somebody's joining us. A little bit late, but they're joining us. Here's another question for you all. If Mr. So-and-so's wife has a Medicare Advantage plan, but he wants to understand what coverage Medicare supplement insurance provides since his healthcare needs are different than his wife's needs, what could you tell Mr. So-and-so? Would you tell him true or false? Would you tell him Medicare supplement insurance would help cover his Part A and Part B deductibles, or coinsurance and original fee-for-service, also known as FFS, Medicare, as well as possibly some services that Medicare does not cover? Is that true or false? Or let me word it a different
False.
way. Let me word it another way. Here's what you need to know for the test. Medicare supplement insurance, Medigap, fills gaps in original Medicare coverages, such as all or part of the deductibles or coinsurance, as well as possibly offering some services such as medical care when a beneficiary travels outside the United States. So the answer I read you is true, and they gave me that box to explain why. So just remember that the Medicare supplement fills in the gaps for that question and offers some extra benefits. They're relating it back to foreign travel, and they're doing that to trick you so that you're thinking of Medicare Advantage plans. That's why I made note of that question, because it's tricky. Let's see what other ones there are that are tricky. Okay. Can Miss Gonzalez purchase a Medigap plan that covers drugs, but she could keep her Medigap policy and enroll in a Part D prescription drug plan? So can she have two drug plans?
No.
Correct. Very good.
Hey, Taryn, we have Charlotte with her hand raised.
Okay, go ahead, Charlotte. You might want to unmute. Okay, I'm going to move on, and if you unmute or if you want to type it in the chat, we'll get to your question. Okay. Oh, I have no questions. Okay. Individuals, true or false? Individuals pay Part B premiums based on their income levels. The income-related monthly adjustment amount, known as IRMA, an income level of $100,000 would mean that a beneficiary would pay a premium more than the standard lowest amount, but not at the highest, which looks at incomes above 500,000 for those filing individual income tax returns. True or false?
True.
Very right. I'm not going over all of them. I'm just going over the tricky ones. See what that
Are you
one
going to
is.
send us all of them?
I can't do that. That's illegal. I would, though.
Have Paul send them to us.
Okay. That one's easy. That's preventative. We all know that's 0. Let's see what this one is. Oh, what was this question?
Charlotte
Okay.
wants to know why it's illegal.
For me to give you the answers to AHIP? Because you have to do it on your own. I'm just helping y'all
the federal government wants us to do it ourselves. It'd be great if we could share the answers, but
I'm just going ahead of everyone so I can say, hey, this is a little bit tricky the way they worded it, and for those who are new, so that you can have a little bit before you get lost in the AHIP. Because I promise you guys, first year, it's a hard test. Okay, true or false? Miss Park can apply for programs through her state Medicaid office that could assist her with Medicare costs, such as Medicare savings programs, Medicare Part D low-income subsidies, and Medicaid. True or false?
True.
Very right. I don't know why, but Medicare savings programs always makes me think of MSAs. So that always, I passed this question, but that one always makes me question it. That's easy. Okay, here's one for you. True or false? Anthony is eligible for a special enrollment period to enroll in Part B because he missed an enrollment period due to the impact of the federally declared disaster. This SEP will allow Anthony to enroll in Part B up to 6 months after the end of the emergency declaration. Anthony may enroll in premium-free Part A at any time, and his Part A coverage, sorry, I did not mean to say B, will be retroactive up to 6 months. True or false?
Are you saying he's not going to pay Part B? To
Let
get
me
Part
see.
B
I was
paid
trying to do
for
a
by next year?
runaround. I was trying to do a runaround with this question. Okay, here's the question. I'll read it to y'all. Anthony turned 65 in 2023. He was not receiving Social Security or railroad retirement benefits on his 65th birthday. He was interested in obtaining Medicare coverage and is eligible for premium-free Part A. Before he could enroll in Medicare, his entire area was impacted by a hurricane, causing massive flooding and severe wind damage. The federal government declared this to be a natural disaster, which has recently ended. During this period, Anthony's initial enrollment period expired. Anthony asks you how he can now obtain Medicare coverage. What should you say? Should you say that he is eligible for a special enrollment period because he missed an enrollment period due to the impact of federally declared disaster? This SEP will allow Anthony to enroll in Part B up to 6 months after the end of the emergency declaration. Anthony may enroll in premium-free Part A at any time, and his Part A coverage will be retroactive for up to 6 months. True or false?
True.
Very good. Charlie, are you monitoring the chat? Because I keep getting Teams notifications.
Yes, I am.
Okay. Let's see what this one is. That one's not tricky at all. This one's, I got it right, but I feel like it was asked weird. Mr. Capadona would like to purchase a Medicare Advantage plan and a Medigap plan to pick up costs not covered by that plan. What should you tell him? I put it is illegal, and that was correct. Okay, true or false, guys? Individuals eligible for Medicare based on end-stage renal disease generally lose eligibility 36 months, not 24 months, after the month in which the individual receives a kidney transplant, unless they are eligible for Medicare on another basis, such as age or disability.
True.
Yes. Okay, true or false? Oh, I read that one twice. I did that one twice. My mistake. Okay, here's one. True or false? This one should be pretty easy. Agent John Miller can help prospect Jerry select a standalone Part D prescription drug plan that complements his current original Medicare and Medigap coverage. Alternatively, Agent Miller can suggest that Jerry drop his Medigap coverage and enroll in a MAPD plan. True or false?
Can he have an Advantage plan and a Part D plan? No.
No, but he can have a Medigap plan
And a Part D.
in Part D.
Right.
Where they're trying to trick you in this question is that the agent can suggest that they drop that Medigap coverage and enroll in a MAPD, which I didn't think was very clear.
Okay.
I didn't think they should suggest that unless it was, you know, in general shouldn't suggest it depending on the beneficiary's circumstances.
Right.
I think that is circumstantial.
So therefore, you ought to share those questions with us.
I am right now.
Oh, okay.
That's why I have my phone.
Should have recorded this.
I am recording it.
Well, send us the recording. There you go.
It should be in the chat once the conference is over. It'll show up in the chat for you guys to download.
Yes, it will. Okay, here is a true or false question. As long as Ms. Pena is covered under her employer's plan, she can enroll in Part B at any time. If she retires, she will be able to enroll in Part B during a special enrollment period that lasts 8 months following the last month of her employer coverage. True or false?
True.
Very good. I'm rewording these questions. This is not how exactly they're worded.
Boo.
Okay. Here, I'm going to read this one because this one was a little bit confusing to me. But you smarty pants, probably it's not confusing to y'all. Shirley Thomas was enrolled in Medicaid during the public health emergency, PHE, is how they're referring to that, by the way. This coverage has recently been terminated due to the end of the PHE, the public health emergency. While Shirley was enrolled in Medicaid, she missed an opportunity to enroll in Medicare and now wants Part B. Which of the following statements best describes Shirley's ability to now enroll in Medicare Part B? Would it be Shirley is eligible for special enrollment period for up to 3 months after the termination of her Medicaid coverage? This coverage will begin the month after the month of enrollment is one of their answers.
Is that true or false?
Yeah. It's
True.
false.
False?
Yeah, that's what I put and it was incorrect. Here's the correct answer. Shirley is eligible for a special enrollment period for up to 6 months, not 3 months.
6 months.
After the termination of her Medicaid coverage under this SEP, Shirley can choose retroactive coverage back to the date of the termination for Medicaid or coverage beginning the month after the month of enrollment. And I do not like how they say the month after the month of enrollment. It's confusing. Why don't they just say the next month?
First of the month following.
Yeah. But they get 6 months. So when they lose their Medicaid coverage, if they have it due to, they're losing it due to the health emergency being gone, they get 6 months, not 3 months. See if I have any more tricky questions. That one's not tricky. That was from last year. Okay, remember this. Remember this for your test. Medicare coverage for individuals with ESRD, which is end-stage renal disease, typically begins the 4th month after dialysis treatment start. So they don't have to wait the 24 months, but they do have to wait 4 months after dialysis starts. And then, regardless of what the AHIP said and what we put in our little slide deck, remember this. Original Medicare Part A provides coverage for hospice care, not Part B. Remember that. It is Part A, not Part B for hospice.
Okay.
And that's it. Those are the questions.
Very good.
Any questions for me?
No, you did a great job.
Thank you, John.
Alrighty.
I get to talk to John a lot. We've developed a friendship. I feel like, don't you, John?
Absolutely, Taryn. That's why I signed up for all 3 o'clock appointments, just so I could talk to you.
Ah, I love it.
All right.
Okay, is there anything that confused anybody that I can help straighten out? Because I know the wording gets wonky. It does. And I do not have anything till 4 o'clock Central Standard Time. So if anybody needs some extra help, you can stay on with me.
Okay.
Other than that, that's all I got, guys.
All right. We'll see you tomorrow.
All right, see you tomorrow.
How do we get the questions and the everything you went through? The
I
recording.
can, the recording will be in the chat of this, or I can send it to you, John.
Okay. Sounds great.
All right.
All right. See you tomorrow. See you all.
Thank you.
Bye,
a good
guys. Have a great day.
You too.
Stay on if you have questions for me. I'll be right here.
Hey, Jared, what is our Wi-Fi system called?
That sounds like a question I ask all the time. Wi-Fi. Charlie, did it seem pretty clear to you?
Spectrum, that's my AHIP.
Yeah, it was great. I think you did a good job.
Okay, I am going. How do I stop the recording? Okay, Patricia Baker would like the recordings. I will write that down.